use of medical cannabis in America has many problems. At the top of that list is the disconnect between the doctor, the dispensary, and the patient. Cannim study is trying to bridge that gap by documenting data on patient relief and the products that they used.
In here, this is Rich and Rick, the other parts of our team.
Betterment of people.
Hey, nice to meet you. I'm Stu.
Rick.
Nice to meet you.
Hi, Rich Battenberg. Nice to meet you, Stu.
Thanks for
Long
having me
trip
in.
for you.
Yes. Yeah. Well, it's a long way from Australia. So
Have you been in the States long?
yeah, we've been over on the East Coast.
Okay.
We've got some studies that we're kicking off over there.
Oh, wow. Oh,
Yeah.
here in the US?
Yeah, in the US. We've just really kicked off what we're doing here. So for us to really be able to run this study effectively, we need partners in every state who can supply THC product for us. And the key to medical is consistency.
No, that's our
exactly what-
thing.
And
That's absolutely our thing.
That's why we're so popular with so many medical patients, especially that have MS, things like that, is because of the consistency. They know exactly what they're going to get when they come back week after week.
Yeah.
Yeah.
So do you have a consumption format that you prefer? I mean, are we talking combustion of dry flower, tablets, gummies, vape?
So our Lumia mission is aiming to capture what people are doing and then report back on that.
Okay.
So if you're taking flour for something, great. Let's understand the impact that's having. And let's compare that with someone who's taking gummies maybe, or edibles or pills for the same reason. And we'll be able to start comparing and contrasting which of those things helps those kinds of people better for that same condition.
Are you familiar with the Energy Star program in the United States?
Yep.
Okay, so they get a seal, this meets certain ecological requirements. Have you considered doing that with Lumiere, partnering with different brands and basically putting a logo on there with a QR code that links to the study?
Absolutely. That's entirely what I'm here to talk to you guys about.
Sure, that's it. Let's talk about how we can help you.
Yeah, perfect. So what we need is product in every state. So if we can work out how we can get distribution into the dispensaries for all of those, and also partner with Clear on a national scale for putting the brand in the study, and that would be awesome as well. Coming out of that meeting, I'm really excited about the opportunity to work with the Battenbergs. I think our interests in this industry align really well, and I think there could be a really great partnership to be had there.
Interesting that they're international. They've definitely taken a medical first approach. You know, I have my reservations about going full medical just because we've seen a pretty significant and steady drop in like medical cards in more developed markets.
In talking to Stu about Cannim and their approach, really felt like we could possibly be leaving some money on the table here at the Clear because we can lean more into the medical market, particularly around recommendations to the aging baby boomer population that is now ready to accept cannabis as true medicine or at least alternative medicine.
Regardless of whether or not you're using a medical card to get it, there's definitely an opportunity to expand into effects-based products, but doesn't necessarily have to be with the oversight of a doctor. I think it's really more about the product quality